Well, progesterone is a hormone that's secreted by the human ovary, and it can be produced in other tissues as well. And unfortunately, it's been placed in a category that, by some, who make it indispensable. And there have been different authors and different individuals who tout progesterone as being the be-all and end-all. Unfortunately, it's not the physiologic hormone that they think it is, and they've attributed properties to progesterone that progesterone doesn't really do, such as protect the breast, because we measure progesterone receptors in breast cancer, and if they're positive, that means that the progesterone was part of that process that created that tumor, because that tumor was sensitive to that. So if it was breast protective, why would it have a positive receptor in breast cancer? What protects human breast tissue is testosterone. And so when women have lost 50% of their testosterone production by age 40, the incidence of cystic disease and nodular disease of the breast goes up because testosterone suppresses that. So the protective hormone for your breast is not progesterone, it's testosterone. Progesterone was created by the human ovary only for about 12 days of each menstrual cycle to prepare the lining of the uterus for a fertilized egg. And when it doesn't arrive, the progesterone secretion is ceased, and then the tissue inside the uterus is shed. Progesterone, otherwise, you can't measure it in the bloodstream because it's just an intermediary compound that is utilized by the human ovary and other tissues to produce testosterone and estrogen. So using progesterone is, like putting in a precursor and hoping that the body does something with it. So the usage of progesterone cream only for stabilization of moods and thinking that it's the progesterone that's working is lunacy. It's not the progesterone that's doing it, it's what the progesterone is being created into, such as estrogen or testosterone. And eventually, just using progesterone cream, you find that you have to use more and more of it because the body says, I need more estrogen, I need more testosterone, and therefore you find yourself slathering yourself with cream because the effectiveness of cream goes down over a period. The longer you use it, the less effective it is. And so the usage of progesterone is only utilized to help protect the uterine lining. It does nothing for breast protection, unlike what so many authors have intimated. But the reality is that progesterone doesn't protect your breast tissue. Testosterone protects the breast tissue, and the loss of it and the inability to stimulate those testosterone receptors in the breast are what cause the nodular and cystic disease of the breast to increase, which is why we tell women to get mammograms at 40. We tell them go get it because that process increases then, but we never tell them why the process increases. We just tell them go get it. We don't tell them that there's a reason why this has happened. It's because you've lost the productive capability of testosterone, and the less testosterone you have, the higher the incidence, then the incidence of breast cancer rises. So by age 50, that's when a woman's chance of getting breast cancer rises 20-fold over what it was when she was 40. Just 10 short years. But what's the change? The change is loss of testosterone, not loss of progesterone.